We're joined now by Dr. Ali Hassoun, an infectious disease specialist at Huntsville Hospital.
Dr. Hassoun, thank you for being with us tonight.
Thank you so much.
As we continue to see large crowds gather in protest, when will we actually see the implications from those gatherings as it relates to the coronavirus?
So it usually takes about 10 to 14 days to know about increasing cases which can be related to that.
Talk to us about the combination of coronavirus with the use by law enforcement of a chemical designed to make people cough and wheeze. Do you see that making things worse?
Absolutely. So anything that make you cough or sneeze gonna increase what we call the aerosolization, meaning getting these particles up in the air, which make it easier to get transmitted to others. Definitely these will increase possibility of transmission.
And during these protests, we didn't see a lot of social distancing. We did see a lot of protesters wearing masks. So talk about masks alone. Is that effective, or is it really the multiple layers of the social distancing plus the masks that are the best protection?
Yeah, Naja, you know, mask by itself is never going to be enough. It might help some in these situations, but physical distancing usually is the most important. So we cannot really just depend on masks. We're going to need to try as much as possible to do the physical distancing, but you can start from the beginning and say those who are sick, those who's been exposed to COVID, or those who at any possibility have risk of COVID should not be coming to these protests. And by that you might be able to reduce this transmission.
Now, would you go as far as to recommend that anyone who was at a protest get tested?
So, and I heard that CDC recommendation. It'll be extremely difficult to do that. And I don't think we have enough tests that we can do on tests for everyone who's been in the protest. I think it's gonna need to be where we need to ask whoever out to pay attention to the guideline and to avoid where we need to do mass testing. But at the same time, if anybody exposed and there is a significant rise, our hospital is going to be affected significantly.
And we've talked a lot about the antibody tests and whether or not it's truly effective. Would that be an alternative that you might recommend, that these protesters maybe get an antibody test?
It's not going to be good. You know, the antibody test just tells you that your body been exposed to the virus, but it takes usually about 2 to 3 weeks to know about it. What we are interested if there is any active infection. And the only way of knowing if there is going to be an active infection would be doing the swab of checking the virus specifically. So the antibody test is not going to be really helpful.
So what if we don't see a significant spike in cases in 2 weeks or so? What do you make of that?
You know, it'll be very hard to tell. You know, one important thing to remember, when we say do the physical distancing and masking, we need to remember what's the prevalence and how many patients infected in our counties. By knowing that, how much exposures as well. We are seeing increase in rates, but could we be lucky enough that we don't have that many of them been in these protests to expose others? I think we'll be really lucky if we don't see significant rise.
Really? We're about a couple of weeks out from Memorial Day. Have we seen a significant spike since then?
Absolutely, yeah. We're seeing definitely increase in numbers of patients that's positive. We've seen it in not only, we used to see it in the surrounding counties, but we're seeing it as well in Madison County. Part of it is we're doing testing more, but part of it I think there's more transmission as well.
And we continue to see here in Madison County, our numbers are relatively low compared to some much smaller counties that seem to have higher numbers. Is there any takeaway from that at this point?
I think initially we probably have done a good job as a community as well as the hospitals to, you know, the physical distancing, following guideline, testing, try to find these early cases as well, tracking them if possible. I can tell you the last 2 weeks it is concerning for us. We are seeing more cases. I know it's not as bad as the surrounding counties, but definitely it's not as it used to be in March or in April. We are seeing increase.
Definitely not over yet. Dr.
Yes.
Ali Hassoun, Huntsville Hospital, thank you very much for joining us.
Sure. Thank you.
In the